Hi there. My name is John Stagner, and I'm the owner of Stagner Insurance Agency here in beautiful downtown Salem, Missouri. And I want to thank all of you for coming. My hope with this webinar is to do a couple of things. One is to take the complex subject of Medicare and break it down to a more digestible form, I guess we could say. It's very confusing. We've all heard the alphabet soup of Medicare, and I like to explain things in plain language, the kind of language that you and I speak, without a lot of insurance jargon. I'm only going to use 3 insurance words throughout the entire presentation. So hopefully by the end of this, you'll understand things a lot better, and no, there won't be a test, but it'll make things a lot easier to understand so that you can make an informed decision by the end of it. And of course, the other thing, my other hope is that at some point you become my client and I become your agent, your broker. And that kind of goes without saying. There'll be a way to reach out and contact me at the end. Now, one of the hard things about doing this is presenting things in a logical sequence, because you might be thinking you've got some questions that are going to be answered toward the end. Now, we're not going to answer every possible question about Medicare, because that would take several hours to do, because it's a very complex subject. But the good news is you don't have to have all of the information. You just have to have enough information that's relevant to you so that you can make a good decision. So I'm going to try to give the most information that applies to the most people. And if you do have a question, you're welcome to put that in that chat. You should have a chat button there. You can ask those questions there. But in all likelihood, I'm going to get to the question that you have at some point. It can just be difficult, to get to do that for everybody at the same time, because everyone has a different experience. So with that, I'm going to go ahead and get started. I'm going to share my screen for the bulk of this so that you can kind of get a little bit of a visual to go along with what I'm saying. And I'm going to hide myself. And here we go. Okay. So when you hear the words original Medicare, we are referring to parts A and B only. You've heard of A and B and C and D, and maybe even some other letters that don't have to do with original Medicare. There's something else, but we're going to get to parts C and D a little bit later. So the easy way to remember what original Medicare does is the 2 letters. If you think of the letter A is standing for the word admitted. When you get admitted to a hospital or a skilled nursing facility, this is your room and board. It's your bed, your meals, and some nursing services. It also covers a couple of other things, as you can see, some home health after you get released from the hospital, and also hospice. Part A covers that. But generally, we think of A as standing for the word admitted. And very simply, Part B does everything else. Excuse me. Part B is doctors and specialists, any kind of labs or tests like x-rays, any kind of medical equipment. That could be wheelchairs and walkers. It could be even durable diabetic equipment, CPAP or BiPAP machines. So Part B really is the part that you're going to use the most. Hopefully, we don't want you spending a lot of time in the hospital. So generally, Part B is the one that you use the most. Now, a lot of people think that original Medicare is free. It is not. It does have a cost. And here's the first insurance word. It's called premium. Now, most people know what that means. I insert the word monthly in front of that. It's what you pay for the privilege of having insurance. You're going to pay this every month. For most people, there is no monthly premium for Part A because you've prepaid. You either worked during your lifetime and you paid in through payroll taxes or self-employment taxes. So you prepaid for Part A. That's already paid for in most cases. And Part B was not prepaid. Part B has a monthly premium this year in 2024 of $174.70 per month. So you pay this every month to have Part B on Medicare. Now, that's what it does. What will it cost when things happen? You have to have medical care. These numbers, keep in mind, are for this year, 2024, when I'm making this video. And these numbers are only for original Medicare. You may have some other type of insurance. We're going to get to some of those. We're not going to get to everything today, but this is assuming that the only thing that you have is original Medicare. So we're going to start with Part A. When you're admitted, remember that's hospital or skilled nursing facility. When you get admitted, you have this thing called a deductible, and it's a common insurance word. This is our second insurance word. A deductible is when your insurance is doing nothing for you until you paid a certain amount of money out of your pocket. Most people understand that. Like if you crash your car, you have to pay a deductible before insurance is going to help you get it fixed. So you have this deductible that you have to meet. So for Part A, your deductible for hospital admission, if you have original Medicare alone and nothing else, your deductible this year is $1,632. And that will cover you for up to 60 days. And it doesn't matter if you get formally admitted for 1 night, 2 nights, or up to 60. That's what it costs for your deductible for Part A. Now, the fun thing about this deductible is it can happen more than once in a calendar year. So there's 2 different scenarios to think about. So think about when you're formally admitted to the hospital, not overnight for observation, but when they actually formally admit you. Imagine that there's a clock that's going to tick for 60 days or a 60-day calendar, however you want to think about it. There are 2 scenarios that could happen. The first one on the left, when you get admitted and then you're in the hospital for some random number of days, you get discharged. Maybe you're in there for 10 or 15 days or 3 days or 30 days. You're discharged. While that 60-day clock is still ticking, something happens and you go back into the hospital. You're still covered because that original 1,632 covers you for 60 days. The other scenario, number 2 on the right, is if you get admitted and then you get discharged again after some random number of days, and you're out of the hospital for a full 60 days, and something happens and then you have to go back in, you have to pay that 1,632 deductible again. So if you take a calendar and break it up into 60-day parts, that could technically happen 6 times in 1 year. I don't know if that's ever happened to anybody, but it is possible and likely if you have some serious things going on that you could get hospitalized, be out for 2 months, and then go back in at some point during the same year. So it's not extremely uncommon for that to happen twice. Now, what happens if you have what's called an extended stay? If you go beyond 60 days in the hospital, that's very rare. We all know that, but we did have a lot of extended stays back in the days of COVID, and people were in the hospital for a very long time. Now, we have our third insurance word here, and our final insurance word. It's called a copay. And this is what happens on day 61. Your $1,632 is done. It covered your first 60, but starting on day 61 through day 90, that will be month 3 in the hospital. You now have a thing called a copay. Now remember, I'm going to explain this. A copay is everyone knows that co means with, like a co-pilot flies with the pilot. A copay means you're going to pay with the insurance company. So a copay is always the part that you pay. So your copay for hospitalization on day 61 through 90 is $408 per day. So in the unlikely scenario that you had a full 3 months in the hospital, your first 2 would cost you $1,632. Your third month at $408 a day, assuming 30 days in your third month, that's a little over $12,000 in copays. That's if you have original Medicare alone. Now, what if you were to go beyond 90 days? Again, very, very rare, but we did see some of that during COVID. You have the easiest way to explain this is think of it like a bucket. It has 60 days in it, and you only dip into that bucket anytime you go beyond 90 days hospitalization. So you reach into that bucket and get those days out. Those 60 days have to last you the rest of your life. And honestly, most people never even dip into them. But if you do have that really extended stay, it's possible. So for the sake of illustration, we're going to pretend that you have a 5-month hospital stay. Remember, the first 2 cost you $1,632 because it's 60 days. The third month cost you a little over $12,000. But starting in month 4, your daily copay doubles from $408 to $816, meaning months 4 and 5 combined, if you used them all at once, would be just under $49,000 in 2024. Now, don't get excited because then again, that is very, very rare, but that's what it looks like with original Medicare. So it really is very good insurance, Medicare is, but these are the things that we call gaps in original Medicare. And again, after that, those 60 days are used up and you have to stay beyond that period, you would have to pay all the costs associated with being hospitalized. Now that's hospitalization. Let's talk real quickly about skilled nursing facilities. And here's how Medicare handles that. They say if you have a minimum 3-day hospital admission, and then you go into a skilled nursing facility within 30 days of that, we've got your back. They'll pay for the first 20 days. After 20 days, it's another copay, $204 a day. Now, they tell us in the insurance world that the average stay in a skilled nursing facility is about 30 to 35 days. You know, it might just be 3 or 4 or 7 days or whatever, because you need some, you need some around the clock nursing for a little bit before you can go home. And it may be longer for some people, but if the average stay is, let's say 35 days, what would that cost you? Well, if you had a 3-day hospital admission first, you would have a $1,632 deductible, and then Medicare would pay for your first 20 of those 35 days, and then you would have to pay the additional 15 days at $204, or just over $3,000. So that's part A. Now, part B, this does get very, very simple after this point. That's part A. Again, the part that you're not using most, but here's a quick refresher on part B. And remember, it's the everything else category, the ones you're actually going to be using a lot. It's for doctors and specialists and the kind of medical equipment, most of the testing, surgeries, that sort of thing that you're going to get under part B. And remember, a lot of things will be billed under part B while you're in the hospital. So you have both parts working at that point. Doctors that come to see you in the hospital, the labs and tests that they do will be billed under part B. So remember, the part B premium when you first come into Medicare is $174.70 per month. Now there's also a deductible that for part B, but unlike part A, it can't happen more than once per year. It's a calendar year deductible. And for 2024, it's only $240. All that means is you're going to pay the first $240 out of your pocket for anything that happens under part B. It could be one doctor visit, and maybe it's some lab work or something. You'll pay the first $240. And then after that, you have an 80-20 insurance plan. It's that simple. Medicare is going to pay 80% of everything under part B, and you'll only pay 20%. Now, we talked about some really big numbers over on part A, but it's generally accepted that this 20% that you have to pay under part B is the largest gap in original Medicare. Why? Because there's no cap, there's no ceiling, there's nothing to ever stop it from going up and up and up. Everyone has heard of someone walking out of a hospital with a $50,000 or $100,000 bill, and I'll imagine having to pay 20% of most of that. Part of it's going to be covered under part A, but you're going to have a lot of it covered under part B, and you have to pay 20% of that. Then it becomes a story of blood and turnips, right? Good luck getting $40,000 out of me because I don't have it. So there's never a point under part B when Medicare says, okay, you suffered enough, we've got it, we'll take it from here, because there's literally no cap on part B. So hopefully this is just all of those gaps here shown on one screen. Hopefully that makes a little bit of sense, and don't worry, there won't be a test later, but there's a reason that I show these things, because it illustrates the need for people to have some other type of coverage along with original Medicare. Now, like I said, it doesn't cover everything completely, as we've seen. For the money, it really is actually pretty good insurance. But those financial exposures that you have there can be pretty big. So as I said in the beginning, you either have something else like a VA healthcare or state Medicaid. It's for people with limited money and resources. Uh, but for most people, if you don't have something else, you just have original Medicare. Most people have two options, and this is very commonly confused. So what I do is I use an analogy to explain the difference between the two. These are two different things. There's a Medicare supplement that's also called Medigap. Those are interchangeable terms. Or the other route that you can go is a Medicare Advantage plan. That's also called Part C. Now we're gonna back up and explain one other thing real quick, but remember that these are two different doors. You cannot go through both. You can't have both. When you go through, be facing a choice with two different doors, you have to pick one or the other. You can't split yourself up and walk through both. You can't have both of these options. You pick one or the other, and they are very, very different. So here's the analogy that I use to kind of explain the difference. Medicare supplement works more like that buffet at a restaurant. You pay one price and it's unlimited. You can eat all you want. And then if you're still not full, or even if you are, you can go back and get more. Everything's covered because you paid that one price for the buffet. And over on the right, the Medicare Advantage works more like a menu. Each thing has a price tag attached to it. So you've got your salad, your appetizer, your main course, your dessert. Each of those things has its own price tag. So it's pay as you go. And then if you need something additional, you want an extra baked potato, you're going to have to pay for that. So everything has a price tag attached to it. So with a Medicare supplement on the left, you pay a monthly premium. That's your buffet price. And then it becomes unlimited medical care after that. Keep in mind, and we're not going to go off into the weeds on this, there are different Medicare supplements that you can get, which will make them more affordable if you have a little bit more skin in the game, but we're not going to get into that today. Medicare supplement, remember, is the buffet. You have unlimited medical care. We're going to go into the pros and cons of each here in just a minute. Medicare Advantage is different because it's pay as you go, meaning that every time you have something done, now you might get to go to a primary care doctor for with no copay, but you'll likely have a copay when you go see a specialist. If you have a surgery, if you take a ride in an ambulance, if you go to the ER, all of these things will have a different copay associated with them. But there's something that stops those from going up and up and up. That's the way the Medicare Advantage protects you, because it has this thing called a maximum out of pocket. So we're going to back up just real quickly here and cover Part D. It's really simple. You remember that D stands for drugs. It's an easy way to remember it. Prescription drug coverage is always through an insurance company, not Medicare. Medicare does not cover prescription drugs. They regulate it. They regulate how they're covered, but they don't provide the coverage for that. Prescription drug plans always have their own set of rules, their own premiums, their own deductibles, all of those things. Again, we're not going to get too deep in the weeds on that today. So here are the two different options we're talking about. How does drug coverage work with each of those? If you go the Medicare supplement route, remember you're going to have a monthly premium separate for that Medicare supplement, and it's a buffet. You'll also have to have a separate drug plan called a prescription drug plan. We just abbreviate that PDP. Over on the right, if you decide to go the Medicare Advantage route or Part C, prescription drug coverage is normally included. There are some other specialized type of plans for veterans, et cetera, if you're getting your drugs at the VA, but it's all rolled into one for the Medicare Advantage plan. So just to illustrate in a different way, option number one is original Medicare. It acts as the primary that the doctors and hospitals bill. And then the secondary payer is your Medicare supplement. And then on top of that, you have a separate prescription drug plan. This option is built for your healthcare. It's not built for extra benefits like you see on the TV commercials. Things like dental and all of that stuff. It's not built for that. It only covers what original Medicare covers. Original Medicare does not cover those extras like dental and vision, routine dental and vision. Excuse me, I've got a horse in my throat today. The other option number two, Remember, you can't have both. If you go the Medicare Advantage route, it has to cover the same things as original Medicare, but now original Medicare is not doing it. It's run by a private insurance company. In other words, think of it as administration. The private insurance company is doing the same thing, covering the same things as original Medicare A and B, but they get to do it in a slightly different way if they want. These plans do have networks, or with a Medicare supplement, you do not. They have prior authorizations, but they do normally come with some extra benefits like dental, vision, and hearing. So it really becomes a kind of a trade-off. You got a few extra hoops to jump through with the Medicare Advantage, but you do pick up some additional benefits. And the important thing, benefits, yeah, people want to talk about those a lot, but the important thing is how does it cover your health? So we're going to get into a little bit more on this, but this thing called maximum out of pocket at the bottom, it puts a limit, that 20% that Medicare Part B that's unlimited, it puts a limit on that. And it's going to vary widely depending on where you are in the country. So there's not just a number that I can tell you. I can tell you what it is in a specific place, but it will vary widely from location to location. So just a quick recap of the pros and cons of each. I kind of did them in green as pro and red as a con. On Medicare supplement, yes, there will be a monthly premium. And again, that's going to vary with where you are in the country. I can tell you in Missouri, where I am, the monthly premium, depending on the type of Medicare supplement that you want to get, the two most popular plans will range anywhere at this time in 2024 from around $115 a month all the way up through 160, 170, depending on your age. That's for a 65-year-old, depending on your gender and some other factors. And those do go up every year. So there's a monthly premium with a Medicare supplement. And there aren't any extra benefits because remember, it only assists original Medicare. It picks up unpaid bills, the bulk of them or all of them. Now, the pros, the positives for Medicare supplement, there are no networks. You don't have to worry about if your doctor or hospital takes your Medicare supplement. If they take original Medicare, your supplement works there. You don't even have to ask. You'll want to tell them that you have a Medicare supplement, but you don't have to ask if they take it. It doesn't matter because there are no networks. A supplement travels with you anywhere in the United States, and anywhere that Medicare is taken, which is about 99% of all providers, your supplement works there. There are no prior authorizations. The insurance company with a Medicare supplement does not get to say whether you can or can't do a thing. If your doctor says it needs done and it's medically necessary and Medicare says, yes, we cover that, then you just go get it done. You don't have to ask anybody. There are no referrals needed. If you need to see a specific specialist, you go where you want. Over on the Medicare Advantage side, those are actually flipped. So one of the pros is there are no monthly premiums or it's very, very low. And it does include some additional benefits like the dental, vision, over-the-counter, things that are not normally included with original Medicare. But you will operate within a network, just like your normal health insurance you had when you were employed. There are prior authorizations, and that happens, they tell us about 70% of the time. You may need to get permission from the insurance company. Is that a big deal? Sometimes it is, yes, but sometimes it's not. But you know, there are examples I could give you. A lot of providers don't like Medicare Advantage plans for that reason because they just want to treat you, they want to get you better, but now they got to stop and ask an insurance company. And there are some referrals needed sometimes, depending on the type of Medicare Advantage that you have. That you need a referral from your primary care doctor to go see a specific specialist. So those are the pros and cons of each. Everyone has their own opinion on them. I just try to present them in the most unbiased way possible. And really, it comes down to how do you want your health care? And can you afford to do a supplement? You know, there are some different options there. Or do you prefer low or no monthly premium? And you have to jump through a few hoops there. So I'm just going to leave that right there. I try to do this in an unbiased way and let people decide and help them if they need help with that decision. Now, real quickly, enrollment periods. This can get confusing, but don't worry, there's good news. There are 3 different enrollment periods when we talk about those that people could be asking about. There's an enrollment period or different ones for when you enroll into original Medicare. Okay, we haven't even started this thing yet. We're getting ready to go into Medicare. When do I enroll? We're going to cover that here in just a minute. There's also, if you choose to go the Medicare Advantage route, there are specific times when you can do that. If you choose to go the Medicare Supplement route, there are times when you do that. Generally, if you're starting at age 65 and you're just starting Medicare, or you work past 65 and you're just starting Medicare, these things kind of all run together at the same time. You don't have to worry about it. You don't have to like do one and then pick a different one. But remember, the Advantage and the Supplement, you're going to pick one of those and not both. So first, original Medicare. This is probably the thing that most of you are interested in hearing. You have a thing called an initial enrollment period. And this will apply to more people than any other when you're turning age 65 and you're retiring. So I should have actually done a graphic for this. Your enrollment window is 7 months. So think about the month that you're born. It's that month, it's the 3 months before that month, and then also the 3 months after. So that's a total of 7 months. And the general rule of thumb is earlier is better. Now, if you're already drawing any form of Social Security, that's SSI, or I'm sorry, SSA, your retirement, or SSDI, Social Security Disability, Part B is going to start automatically. That's not SSI, that's different. If you're not already getting some form of Social Security when you turn 65 or retire, you're going to need to self-enroll. You're going to have to be proactive about it, and we can tell you exactly what to do there and actually help you with it. So this is the most common thing for most people. Now, if you worked past age 65, so you didn't start Medicare Part B at age 65 because you had health insurance through your employer, and that employer had 20 or more employees, then you create what's called a special enrollment period. And you don't have to worry about any penalties or anything like that. It's perfectly okay to do that. You're going to need 2 forms to get enrolled, and we provide those routinely for our clients. This is a 8-month special enrollment period after your employment stops and you lose that coverage. And then there's called a general enrollment period for enrolling into original Medicare. This is if you missed one of those other 2, the initial enrollment period when you turn 65, or you didn't do it within your window of, after you retired after working past 65. And this is a 3-month period. It runs from January 1st to March 31st. And whichever of those months you enroll in, your coverage for Part B starts on the first day of the following month. If you missed one of the first 2 enrollment periods we just talked about, initial or your special enrollment period, and you have to do it here, you don't want to do it here because you're going to create a lifetime penalty that you'll never be able to get out of. It's not huge, but it can be depending on how far you miss that enrollment period by. So real quickly, I put all these on one screen because we don't want to get off too far into the weeds with these. Enrolling into Medicare Advantage, if that's the route you choose to go, it generally runs right along with your enrollment window. It's based on your Part B start date. So generally, most people are making these decisions when they start Medicare Part B. This is called your initial coverage enrollment period. Another one, this is the one that you hear about every year, and when the TV commercials and the phone calls and the junk mail just go bonkers. You all know what I'm talking about. If you're close to 65 or already there, you just get bombarded at the end of the year. Annual election period. Some people call it open enrollment. That's incorrect. It's actually annual election period. But I say that because I'm kind of a nerd, a word nerd, and this is actually what it's called. It's for Medicare Advantage and prescription drug plans only. That's what the fall enrollment period, October through December, is for. Medicare Advantage and prescription drugs only. You can make a change to the plan that you have now, or you can enroll or disenroll for the following year. when you enroll during the annual enrollment period, the second one here that we're looking at, your plan begins January 1st of the following year. So basically what you're doing is you're making an election for an annual plan that's going to start January 1st. And then there's the open enrollment period. That's January 1st through March 31st. This is for Medicare Advantage only. If you made a mistake, or maybe you got pressured or bullied into switching your plan so some agent somewhere could make some money, you have one opportunity during these 3 months to change your plan. Or you can drop your Medicare Advantage and go back to original Medicare and pick a prescription drug plan. And then finally, special enrollment periods. These are not based on a calendar date. They're based on life events and things that happen, other circumstances. For example, you moved from one state to another or one area, and the Advantage plan that you had no longer covers you because it's based on where you used to live. There's about 24 of these, actually a little more than that, where you have an opportunity to change Medicare Advantage plans. But that's what the special enrollment periods are all about. And then finally, a Medicare supplement. We get this question all the time. This crazy time that we just talked about, annual enrollment period, or we call it the fall enrollment period. They call it open enrollment period. This from October through early December. That does not relate to or pertain to Medicare supplements at all. There is no annual enrollment period based on the calendar for Medicare supplements or Medigap plans. They don't have to be reviewed each year. You get it, you set it and forget it, and it's for life in most cases. Doesn't mean that you can't move to a different one at some point, but there are no annual enrollment periods for Medicare supplement. You can actually sign up for a Medicare supplement any time of the year if your health is good and you can pass medical underwriting. What does that mean? 2 to 3 dozen health questions. They're going to look at your health history, and they're going to look at any treatment that you're getting now, if you have any chronic conditions, and generally you have to be in pretty good health to get a Medicare supplement. If you can't, there are a few exceptions where health questions don't apply. Guys, this is very, very important. That's why I go through all of this. When you're first coming into Medicare, you have a 6-month enrollment window when Medicare Part B starts that they cannot ask you any health questions. You have to be accepted by the insurance company. That is very, very important for people who may already have a chronic health condition and you would prefer to have a supplement. If you miss that window, you might be stuck. And what infuriates me and infuriates a lot of people is a lot of people are not even being told about Medicare supplements when they had an opportunity to get one. Why? Just to be brutally honest, we get paid more for doing a Medicare Advantage plan. And I think that's a crime. I think it's criminal because it incentivizes agents to do the wrong thing and to not even talk about Medicare supplements. So that's why I believe in education, letting people know about all of their options. A couple of other opportunities to get a Medicare supplement without health questions. Basically, number 2 there, you can read all that. It's if you lose other coverage, like if you, now this is a good one here. You lose a Medicare Advantage plan because you moved out of its service area. In other words, maybe you moved to a different county or a different state, and all you've ever had is a Medicare Advantage plan. Well, you have an opportunity. It's a short one. It's a couple of months to get a Medicare supplement. This is great for, if a person finds out about a supplement and then they decide they want to have one, but they can't because their health isn't good enough. This is an opportunity to get one. You lose employer coverage or you drop them, and this isn't important, these last two. If you drop a Medicare supplement, you've never had a Medicare Advantage plan, but you want to try it. Let's say that you don't like it. Anytime in that first 12 months of your Medicare Advantage, you can go, get me out of this thing, put me back with my Medicare supplement. And you can do that. Or if when you turn 65 and you start out with a Medicare Advantage plan, at any time in the first 12 months, you want to return to original Medicare and get a Medicare supplement, you can, and you can do it without health questions. So those are some opportunities that don't happen for most people, but they do exist. And then the final thing, a lot of people aren't aware of this. If you have Medicare prior to age 65, because you have a disability, Everything resets at age 65. There are people out there who have Medicare due to a disability. Maybe they've got some late enrollment penalties. We're going to talk about those in just a minute. Or they have a Medicare Advantage plan and they're very unhealthy and they would rather have a supplement and just not have to worry about, going to the doctor a lot. You get a second opportunity when you turn 65 because everything resets as if you never had Medicare already in the first place. So that's pretty cool. A lot of people aren't even aware of that. And yes, finally, we're almost done here. The penalties. Uh, I call it the monster under the bed because a lot of people use these fear tactics, and it makes you wonder, is there really a monster under the bed? Do I need to be afraid of these? So really, I'm going to explain those really quickly. They're very simple. The first one is called IRMA. I'm going to go through these one by one here in just a moment. And then the other two are late enrollment penalties. So the first one, IRMA stands for Income Related Monthly Adjustment Amount. We just call it the IRMA penalty. All it means is if you had a high income, you're going to pay more for your Medicare. So you look at your tax return. They always look back 2 years. They look at 2 years ago to when your Part B started. I mean, 2 years before your Part B started. So if you're looking this year and going, well, I have an IRMA penalty, it's 2024. So we look at your 2022 tax return. If you, as a single filer, made over 103,000, or as a joint filer made over 206,000, you'll pay a Part B premium between $244.60 and $594, depending on how high the income was. That's not going to apply to most people. And then your Part B you'll pay a premium between $12.90 and $81 as a IRMA penalty. So again, that doesn't apply to most people. And then the late enrollment penalties, basically those happen. We just went through those when you don't file for Medicare when you were supposed to, and you wind up doing it later. You wind up using that third enrollment period called the general enrollment period. So when are you supposed to sign up? This is really pretty simple. When you turn 65, and it happens automatically if you're already receiving Social Security or disability. If you aren't, if that's not the case, you're going to have to self-enroll. If you worked beyond age 65, here's the rule. You have health insurance at work and your employer has over 20 employees, you get to choose whether you start on Medicare Part B or not. You can delay it. So if you're in that situation, you're safe from penalties because you have something called creditable coverage through your employer already. So you're not going without insurance. So you're not going to be subject to any kind of penalties. You can sign up for Parts B and D later when you actually do retire, and you won't have any penalties. So the bottom line is, as you can see it there on the bottom line, if you file for Medicare on time and you didn't make that much money 2 years ago, that 103 or that 206,000, you can relax. There's no monster under the bed. So guys, that's it. Hopefully I've covered most of the questions. I'll get to the chat questions here shortly. My invitation to you, very simple. If you want to work with an independent broker, that's me, who will educate you without pressure. I'm not employed or biased toward any particular insurance company. And I do understand the power of word of mouth. So that, that ensures that I take good care of my clients because nobody wants anyone saying anything bad about them. So you always do the best to serve your clients. You want a broker who will always work in your best interest, not theirs. Someone who has an intimate knowledge of the local area, the local networks, the providers. I make the rounds and speak with all the providers and the pharmacies every year. Someone who will actually return your calls, and someone who will be accessible whenever you have questions or issues or even emergencies along the way. Jot down this number at the bottom of your screen or now at the top of your screen. Just some of my credentials there. Guys, I really appreciate everyone joining. We're going to go to the Q&A, the chat questions. I'll get some of those answered now. And again, I would invite you to call or text that number. Or you can go back to the email. You'll be getting a follow-up email after this webinar. And again, I appreciate all of you. Thank you for coming. And We will talk to you soon.